Okay. I think that for your section, we'll go ahead to section C, and we'll go ahead and let Dr. Martin Nielsen, I'll introduce Martin, lead off on this section of the questionnaire. So Dr. Martin Nielsen is at the University of Kentucky, and he's already been assisting us in the study because it's his lab that has been identifying the parasites in the pre and post deworming samples for those operations that agreed to do the parasite section of the questionnaire and also send in samples. So we've been working with Martin for many months for those operations that agreed to do this part of the study. Just to clarify, for those operations that have already agreed to and are participating in the parasite phase of the study, there's an intro question in this section that the VMO or coordinator needs to complete, which if they've already done this section of the questionnaire, they've self-completed it, you don't need to administer this section of the questionnaire to those operations. And right now that's at 131 operations, and I think that's all there will be prior to the VMO visit. So this section was a priority within the needs assessment to learn more about what equine operations do for internal parasite control. The AAT has come forward with guidelines for parasite control, and Dr. Nielsen actually led the task force that developed those guidelines. And one of our objectives is to assess the parasite control on equine operations. And so what we plan to do is see what people's responses are and what they're doing and compare it to the recommendations or guidelines. So Martin, with that, I'll let you go ahead and kick it off. Maybe address why we're asking the questions we are, any areas that you think could be problematic in this section for people.
Sure. Just a quick question up front. So I only have 6 minutes to do this, correct?
No. We have until 11:30 our time, so whatever that is our time.
Yeah, but you don't want to take another break at 10 minutes, you know, till whatever the hour is?
Why don't you go to the top of the hour, and we'll take a break.
All right, that sounds good. Okay, so hello everybody. I'm really excited to be part of this big project. I think we have a unique opportunity now to really get some nationwide information about something that everybody deals with, which is parasite control. And we don't have this information. There really isn't any kind of information about what people do in terms of parasite control on a national level in this country. We have a little bit of some state-specific information, but no real survey data. So this is really a unique opportunity. And I also remind everyone that in the NAHMS 2005 survey, parasite control was not part of that project. So we need to go all the way back to 1998 to have any data on parasite control in horses in the U.S. So 1998 is a long time ago for many reasons, but specifically for the reasons that Josie just outlined, namely that we are recommending a complete change of paradigm in terms of how you approach parasite control. Back in the good old days, we could probably get around, getting this data on parasite control very quickly, because it would just be a matter of asking the people on which dates on the calendar do you deworm and with what, and then period. That was it. Nowadays, it has become much more complex, not because we want it to be complex, but simply just because of biology and all the resistance that we're seeing develop. And by the way, we do have a training module prepared, and it should be on the website as far as I know, where I have a PowerPoint with an audio that should update you all on what the current status of parasites in horses is. So if you want to get updated with the most recent information, and what the concepts and philosophies are behind those recommendations we're giving, I encourage you all to spend a little bit of time looking through that presentation. So when you look at the questions, you know, the complexity comes in, and this is an area where, you know, you may be facing some challenge. The complexity comes in where we ask a question, for example, the question 5, which is what deworming program is currently in use for the following equines. Like I just said, well, in the good old days, that would be easy. Now we have to differentiate between different age groups, because biologically, you should not approach parasite control the same way. We are aware that probably a lot of people, you know, treat all their different age groups and categories across the board the same, but they may not. And certainly the recommendations are to really go by age group and approach them very differently. A foal is not the same as a yearling. A yearling is not the same as an adult horse. Stallions may be completely different because they're managed and kept very differently, you know, than equine. So we have the same question really broken down by horse category. To some of your respondents, this may seem completely redundant because to them, it just feels like you're asking the same question over and over and over again. So bear with them, be a little patient, I guess, and maybe try to explain that, you know, there are reasons behind this. So that's one area where we really see maybe a little bit of a challenge. The other one is, you know, if you ask about deworming and what people deworm with, you know, there are so many different product names out there, and they keep changing all the time. But if we don't get that specific information, exactly what people are deworming with, then the actual answer is not worth very much to us. So we have tried, and this is also available to you, to compile a complete or as close to complete list as possible of all the currently available deworming products that are labeled for horses in this country. And with pictures, I mean, this is an amazing job done by the NAHMS folks. I really wasn't much involved with that, but, you know, look at that and try and see if you can even guide your respondents to, you know, choosing the right product. And so, you know, we ask about the active ingredient, for example, ivermectin, but there is a plethora of different products that are containing ivermectin. So just be aware of that as well. Also, and this is something we have come across already just with the operations for which we have conducted the fecal egg counts, that, you know, some of them tend to be, let's say, quite alternative in their approach for parasite control. And I come across this quite often. I'm a crazy horse owner myself, so I can see where this is coming from. People using herbal medicine, people using diatomaceous earth, people using all kinds of things, garlic extracts and things that they think work against parasites. And so the questionnaire itself doesn't really necessarily allow people to account for their own little natural parasite control strategies. So I really encourage you to make use of notes to try and cover these different scenarios as best as possible, you know, realizing that, you know, that's not as easy necessarily as it sounds. So let's see. Also, the other central point or a keyword here in these questions is we want to find out to which extent do people actually use parasite surveillance, or in other words, to be specific, parasite egg counts as part of their parasite control strategy. And again, do you use egg counts is yes or no. It's not really a useful piece of information for us, because in case they do use egg counts, we want to know how they use them. So the set of the questions here, again, broken down by horse category, because you may use egg counts differently in foals compared to brood mares, for example. And we want to know if people actually are doing that, or if they just kind of do everything across the board. My hope as a parasitologist who specializes in equine is that this survey will teach me, if nothing else, it will teach me how I maybe should change my message, or, you know, effectivize my communication about certain aspects of parasite control that clearly has not gotten to the end user. I'm anticipating that there will be some things that certainly we would not consider as in agreement with our recommendations. So it's going to be really useful to know, where are the potential misunderstandings, misconceptions, or flaws in people's approach to parasite control. And treating all horses the same across the board is certainly one mistake that they could be making. And we also have, at the very end, a few questions. This is something that people are very interested in, namely pasture management and the like, so other management approaches that could also somehow affect or reduce parasite burdens. People out on horse farms are usually very, very interested in this. In case people get really enthusiastic about parasite control, this is something we see a lot of them do with a great enthusiasm. I should maybe paraphrase that a little bit and say this is something we see a lot of enthusiastic horse owners have their husbands do on Saturdays, and then they may reward them with maybe an HEV if they do it well over time or something like that. But anyway, joke aside, but that actually is something that we see. So we do have some questions, and this is something we could have gotten much more into detail about, but just to kind of get a little bit of an idea about, raking, mowing, pasture hygiene. You can buy vacuum cleaners nowadays to actually, remove all the feces from a paddock, for example. So to which extent are people doing this, rotating pastures and so on and so forth. And then the last thing is that we want to find out is what is the current awareness of parasite drug resistance among these respondents, and to which extent has it potentially affected their approaches for parasite control. So have they heard about it, and are they concerned about it, is really what we're trying to find out here in those last questions. I think, Josie, that's, without going into too much detail about each and every question, I think they're pretty logical, I hope. But I'd like to open the floor for questions if anybody has any.
So instructions are to hit #2 if you have any input from what Martin talked about, or if you have any questions for Dr. Nielsen.
And we did receive a text question from Ross Freed that asks, how will we be able to tell which participants have already completed the parasite control portion of the study? I know it was mentioned before, but I think I missed the answer.
It should have been part of the Excel file that you received, Dr. Free, with the participants' contact information. Abby's going to be checking on that to be sure. If you didn't get that in that file, they'll work out getting that to everyone. It should have been with the file with the participant's name and address and phone number. So if you didn't get it, just drop her an email and we'll get it resent. It's also important when we get to the biologics whether they participated or not already. Anything else? So as Dr. Nielsen mentioned, he's done a very nice training module on parasite control. I think listening and viewing that for everyone that's going to go out to the farms to collect data will be important so that you at least have some background as you work through the questionnaire. Dr. Garber, did you have some specific input you wanted to give on the questionnaire?
Yeah, on question number 10, on question number 10, there's 2 columns, and I think on the question about did your veterinarian recommend this practice, we want them to answer it regardless of whether they answered yes or no in the first column. Is that right?
I have my copy. So.
Yes, that's correct. Thanks for pointing that out. So again, I didn't, that there was a little bit of disconnect. So this is question 10 for everybody, question 10, and it has 2 sets of responses, yes or no. One is, what do people do actually, and the other one is, did your veterinarian recommend this? So they could, for example, mow their pastures, yes, but it wasn't recommended by their veterinarian. That would be a no. Or it could be the opposite. The veterinarian is recommending it, but they don't want to do it for whatever reason.
Thanks for that clarification. Anything else on parasites? Pound to or write in a question?
So we are going to talk about this also next time, because we're going to talk about the biologics and what that all is about. So we'll get back to parasites next time around.
Yep, on March 30th.
Yep.